choose your next move very carefully because this sketch about the chambers of the heart and pulmonary circulation is a game of suspense and intrigue. Around each corner, we'll get closer to the heart of the mystery, a true crime of passion. But before the dice heat up, a quick look at the map of the board. The heart is a muscular organ that pumps blood through the circulatory system, and it is anatomically located between the lungs in the middle mediastinum of the thorax. All right, highest roll starts. The game begins at the very back in this L-shaped courtyard, covered by an A-framed glass atrium. This should remind you that the left atrium is the most posterior chamber of the heart. Given its anatomical position, the left atrium lies in front of the esophagus, hence this goose game piece. In fact, left atrial enlargement can compress the mid-esophagus, causing dysphagia. To remind you of this clinical pearl, a player is grabbing the goose's neck, about to take a turn. Rarely, an enlarged left atrium may compress the left recurrent laryngeal nerve, a branch of cranial nerve 10, causing Ortner's syndrome, which is characterized by hoarseness. It just so happens that this horse game piece is making its way through the left atrium. Take a closer look at the horse and you'll see the yellow rein on its left side, our recurring symbol for the left recurrent laryngeal nerve. On a test question, you might be asked to identify which chamber of the heart is enlarged on CT in a patient with a history of rheumatic heart disease presenting with dysphagia and/or hoarseness. The physical exam may reveal a murmur consistent with mitral stenosis or regurgitation, which can cause left atrial enlargement over time, leading to these findings. Before we leave this chamber, here's another clinical point. The left atrial appendage is the most common site for thrombus formation in patients with AFib. This extension off the courtyard is a reminder of the left atrial appendage, and the sticks of firewood represent blood clots that like to form in this area. Nothing like a suspenseful thriller to stiffen the blood. Oh, and these sticks are scattered irregularly to help you recall AFib, with that classic irregularly irregular rhythm. The entrance to a crime scene is never complete without a photograph for evidence. This T-con camera is situated to remind us that the left atrium is the chamber of the heart closest to the ultrasound probe during a transesophageal echocardiogram, or TEE. TEE is used for looking at the backside of the heart, including the left atrium, atrial septum, and mitral valve. Well, now that we've dusted this room for prints, the next chamber awaits. From the left atrium, oxygenated blood flows into the left ventricle, which comprises the left lateral portion of the heart. A gym. Interesting. The plot thickens. The thick walls of this muscle-building fitness room, lined with vents, correspond to the sizable left ventricle. Its walls thickened to ensure blood is pumped to peripheral tissues. Maybe all the vents in this room help air out sweaty smells or a deathly odor? Ugh, I'm getting nauseous. Follow the scent to the music room, also known as the right atrium, in case you didn't tell by the shapely letter R and another glass atrium. Heads up, the superior and inferior vena cava return the deoxygenated blood into the right atrium. Don't mind the eerie rhythms of this self-playing piano. Nothing suspicious about that. Just a couple of key findings to note. The locations of the SA and AV notes. Let the tune of these SA musical notes remind you that the SA node is located in the right atrium near the opening of the superior vena cava. The AV node, depicted here by these AV musical notes next to these three books, is present next to the septal leaflet of the tricuspid valve. Knowing the anatomy here is going to be important during AV ablation procedures. And now, door number 4. Of course, the dining room. Another well-ventilated space. This is the right ventricle, the most anterior chamber of the heart. And here it is, the scene of the crime. This blood-stained carving knife ought to stick with you as a reminder that penetrating trauma to the left parasternal area can puncture the right ventricle. So, where did the culprit escape to? Well, from the right ventricle, blood moves through the pulmonary circulation by first entering the pulmonary trunk. This decorative pulmonary tree is a conveniently located symbol. The tree trunk will remind you of the pulmonary trunk, which then divides into the right and left pulmonary arteries, denoted here by these tree branches. The pulmonary arteries then carry oxygen depleted blood to the lungs. After gas exchange takes place, the four pulmonary veins, represented by these blue pencils, return the oxygen rich blood to the left atrium, completing the pulmonary circuit. You'll want to keep pulmonary circulation in mind for more than just late night sleuthing.
Consider pulmonary artery or Swan-Ganz catheters.
Which measure the pulmonary artery occlusion pressure. This pressure is calculated by wedging a catheter with an inflated balloon into a small branch of a pulmonary artery. To remember that, we'll tie this balloon to a pulmonary tree branch. Notice the balloon drifting from the pulmonary branch toward the left atrium. PaOP indirectly measures left atrial pressure, which is useful for hemodynamic monitoring. Was that thunder? It's getting pretty late and stormy. Time to wrap up this video with the pericardium, a membranous double-walled sac that wraps around the heart. The pericardium is denoted here by this red velvet sac of game pieces. Consider its rather large silhouette. To identify a pericardial effusion on a chest x-ray, look for an enlarged cardiac silhouette and clear lung fields. And now for a final hint, or clinical pearl. We return to the right atrium. To access the left side of the heart, cardiac venous catheters don't actually go through the pulmonary veins because the pulmonary capillaries are too small to fit a catheter. Instead, the catheter must cross the fossa ovalis, an opening in the inner atrial septum. Kind of like how this cat burglar must pass through the open door to get to the courtyard. Well, after a careful study of these four chambers, it would seem we've snagged a leading suspect. Now, to retrace our steps. The heart has four chambers, 2 atria and 2 ventricles. There's also the septum, which divides the heart into left and right sides. The left heart supplies oxygen-rich blood to peripheral tissues. The right heart, in contrast, delivers oxygen-depleted blood to the lungs, where gas exchange occurs. The heart also has 4 valves that prevent backward flow of blood. The atrioventricular valves separate the atria and ventricles, and the semilunar valves separate the ventricles and the great arteries. That's the aorta and pulmonary trunk. But more on valves in the next video. I don't know about you, but I don't think I'll forget the outline of this scene anytime soon.